This is a video on how to set up and function in an aseptic zone. So the first thing you need to do is make sure that you are prepared to work in the aseptic zone, which means you should wash your hands, make sure they are properly cleaned before moving on to your aseptic area. Then when you're working in an aseptic area, you're going to be using an open flame, so you should, as always, make sure that you're properly attired, any loose hair is tied back, and you're not wearing a hat with any kind of brim. Also, check your workbench and make sure that there's no papers or anything else that's flammable. Then we need to disinfect our workbench. We do that with 80% ethanol. Keep in mind that we are disinfecting the workbench and we're not sterilizing the workbench, and it's important to know the difference. We put just enough 80% ethanol onto the bench to make sure that everything has been disinfected, and we leave it there long enough until it dries. With yourself, you should also make sure that your lab coat is fitting properly. If your sleeves are a bit too long, it's a good idea to tape them rather than roll them up, because if you roll your sleeves up, you're losing the point of having the sleeves in the first place. So to tape your sleeves, which is normally done in higher level biohazard labs anyway, you take a long piece of tape, place it onto the sleeve, and then wrap the tape around gently but securely so that the sleeves will not interfere with your experiment. To continue setting up the aseptic area, we need to introduce our open flame. Here I'm going to be using a Bunsen burner and a flint lighter. Make sure that you're comfortable how to set up the Bunsen burner, and if you're not sure, refer to the fire safety video that we have. The flame should be about hand distance away from you. This is going to be your working zone, and that's about 25 to 30 centimeters from the edge of the bench. If your Bunsen burner is too close to you, you're losing your working area, and if it's too far away, you're going to be forced to lean forwards. You should always be sitting and standing in front of your bench at an appropriate height so it's comfortable to work, and you should never have to lean forwards. Keep in mind that whatever you're doing in the aseptic zone has the potential to contaminate it. The aseptic zone is created by the airflow that's going in the base of the Bunsen burner and then drawn upwards and around in an almost donut shape. The size depends on the flame that you have, but for a normal size flame that I have here, it's about 20 to 25 centimeters radius from the center of the Bunsen burner out into a circle. Many things that we're going to be doing in the aseptic area require moving liquids from one container to another. So here I have some microcentrifuge tubes, and I have a bottle of solution that I need to move into the tubes. In order to move the solution, I need to make sure I can open and close the containers and keep everything inside sterile. If you see, there's a piece of autoclave tape with black markings on it to show that it's been through the autoclave. This confirms that the contents inside this container is sterile. Because I'm going to be using it, I'm going to take off the autoclave tape and just place it on the bench to the side, because I don't want it to catch fire when I heat up the bottle. To open the bottle, I open it, have my tubes in front of me, I flame the lip of the bottle and place that down, and place the cap also behind the Bunsen burner. I flame the bottle not to sterilize the contents or the lip of the bottle, but rather to heat up the bottle and then cause very gentle air currents to be pushing out from the bottle so that no contaminants can be falling inside. I place the cap inverted because the surface is not sterile, it's disinfected, and I don't want a non-sterile surface to touch the inside of my cap. I place both items closer to the back of the Bunsen burner so that I don't need to reach over any of them to get to my experiment. To move the liquid from my bottle into the tube, I'll take a pipette with the disposable tips. The tip box is never opened longer than it needs to be. And I can simply transfer my liquid into the tube, closing the tube as soon as I'm finished. When you're finished with the bottle, close it. Ideally, I should only be opening the bottle as soon as I need it, and close it whenever I'm not using it. And you can move it outside of your aseptic zone now that it's closed. For the individual microcentrifuge tubes, it's important that when you have the tubes, you're keeping the inside sterile. So I can touch the outside, but I need to be careful of how I open the tube. If I open the tube with my thumb, pushing across the top of the tube or touching the inside of the tube, I've contaminated my tube and the inside will no longer be sterile. The proper way to open the tube is to gently push it open with your thumb and release, never touching the inside of the cap or touching the inside of the tube. A very common method of opening the tube is just to put the tubes onto a rack and then gently pull them open. Finally, an important aspect of this is to make sure that you're not moving your hands over top of anything that's open. I place my bottle and the cap to the side or to the back of the Bunsen burner, and I use my hands going in sideways or forwards, but never over top of either my experiment and of course not over top of the flame. Another common type of tube that you're going to be using is a culture tube. So these could be referred to as test tubes. In biology, we grow a lot of cultures in them, so we'll call them culture tubes. They're a glass tube with a loose cap on top. When we're transferring liquids from a culture tube into another container, we're almost always using the micropipette. So once again, we're using a micropipette, opening our container only as long as it needs to be to get the disposable tip. With our culture tube, we usually need to hold it in our hand. So we don't want to have to deal with the cap. There's two ways to deal with the cap. One is to transfer the cap into your hand with the pipette. Your hand with the pipette, extend your pinky finger and clasp onto the culture tube, holding onto the lid, allowing your other hand to hold on to the tube. And then you're free to pipette as you need to. Another common method of opening and closing the tube is opening and closing the tube with one hand. This takes some practice, but it's a very handy skill to learn. And it's basically when you lift up the tube, you're still able to flame it if necessary and close the tube without ever coming into contact with the top of the tube or the contents inside. There is a technique on how to do this. Even if you have rather small hands, it's quite possible to do this easily by scrunching your hand up tighter so that your pinky and ring finger are much higher up on the tube than down at the bottom. If they're at the bottom, you're never going to have enough room to open the tube. Crunch your fingers up, and that leaves your ring finger free to maneuver the tube, and then your index and thumb to hold the cap. Once our experiment is finished, we can put everything away, turn off our Bunsen burner, and then disinfect the area once more. Again with 80% ethanol, wiping down our entire work area. And disposing of everything appropriately. This was a video on how to set up and function in an aseptic environment.